policy we inherited was cynically described as cash and carry. That is, if you are not well, you go to hospital and don't have money. Even if you are lucky to get a doctor that would examine you and prescribe, it will be just a sheet of paper given to you, signed by him. Go and find the medicine. If you can't buy it, you go and die. The cash and carry. And we said no, that shouldn't be the thing for the people. So we really worked to introduce the National Health Insurance Scheme. Along the way, we also added the free maternity care.
Pregnant Nana, not her real name, is rushed to the maternity unit of the 37 Military Hospital in labor. She's a National Health Insurance Scheme NHIS subscriber, meaning she did not have to pay for anything under the free maternal healthcare policy.
The free maternal healthcare covers maternal health services from pregnancy to delivery and through to postnatals. So when a woman is pregnant, she's covered.
But what turned up was a total cash and carry affair, as she paid for covered services before being provided the needed health care upon arrival at the hospital.
So the health insurance doesn't cover drug
This
testing?
is private health insurance. It covers when you go for consultation, but not for private.
It only covers consultation. Hey!
Ghana comes free.
Ghana comes free.
Nana and her husband, a farm worker, lacked the finances to pay for the bills, so every bill given to them was followed by phone calls to relatives and friends to beg for money. After spending over 3,000 Ghana cedis already on bills, the couple is hit with the tragic news: their newborn could not survive. As if that is not enough, the grieving parents were then hit with another news of the body being detained till a 1,064 Ghana cedis 17 pesos being the cost of staying in the neonatal intensive care unit prior to the death is completely cleared before a death certificate and clearance would be issued for the release of the corpse.
Okay, so after paying it,
You bring the receipt. Bring the one and pick one.
okay,
They will give you the desserts.
okay.
The NICU bill was not the end of their trauma. While they grieved their loss, they were again confronted with where to find the financial help to settle the NICU and mortuary bills. The compounded bad news left the couple numb.
Yakumu ko to kaya ho after akola be da me yatu go jama me be kata moto. Amla hospital to transfer what you say. It's a home insurance here na to bi amumu kata na ni me tiase. Ado da na ko blewo. 37 home a. It's about go mo tell na ni hu na me no. Ah yes yeah adan ten insurance. Insurance here yeah that so na ebe yewu. E ka da sa kia me bo mo twa na ye ya akola kete na mami. Ha da me pesa me ko me ko. Madam. Ya tan kutwa. Kwa hasi ukwa na omo diska oboko bia skasam kwa pemeta mesaka akwala no.
Mrs. Adokobia, Deputy Chief Executive Operations, National Health Insurance Authority (NHIA), described this situation as totally wrong and unlawful.
If the baby dies, they still submit. You submit your claim because the patient was attended to within a period. The patient was attended to within a period. So you have to submit the claims and we'll pay.
So the hospital shouldn't hold the body
That they are
the
owing.
family pays a bill.
That is not right. That is not right. That is not right. So if somebody is admitted to a ward and something happens or the patient couldn't make it, the facility is supposed to submit a claim for the period that the patient was there, the medication that was given, the diagnosis that was given, and the facility should submit a claim and National Health Insurance will pay. There shouldn't be any reason where a body will be held that they have to come and pay before the body is released to the relative. It is not right.
Corruption Watch contacted the 37 military hospital for comments, but as at the time of filing this report, they had not granted an interview 6 weeks after submitting a request. Nane's case is just one of several ordeals pregnant women and their partners go through in our government hospitals despite being covered by NHIS. Corruption Watch investigator Francisca Enchil goes undercover to expose the agony of pregnant women in hospitals, a spectacle of pregnant women being confronted with the option of paying cash before accessing the otherwise free healthcare under the free maternal healthcare policy, or refuse to pay and die. Corruption Watch uncovered this pay or die phenomenon in investigations conducted at the 37 military hospital, Mamprobi Hospital, popularly known as Mamprobi Polyclinic, and Mamobi General Hospital, popularly known as Mamobi Polyclinic. The investigation found gross abuse of the purpose for the introduction of the free maternal health care policy. It was found that health facilities have set their own rules to extort money from pregnant women during antenatal, delivery, and postnatal care. Some of these illegal payments that put unnecessary impediments on access to maternal health care have somehow been made official. Hence, pregnant women are directed to make payments at the bank. The investigation also found that health workers charge and directly take payments without issuing receipts for charges which are supposed to be free.
And the health insurance card now you can home for so and you could have seen now the call health insurance. We should have present day. Bibia, me tell drone, farm, she said, we should have got my cards in pony.
Insurance na bank as well, but I need kind of test me, second test, malaria, ESR.
Our investigation established that free maternal health care is currently only on paper, but practically it is non-existent in all the facilities captured in this investigation, although hospitals made claims for services rendered under free maternal health care, and those claims are paid for by NHIS. Although the NHIS policy pays higher claims to the referral hospitals than those paid to the polyclinics and general hospitals, it was established that at the referral hospitals, pregnant women are unlawfully charged higher amounts for the same services provided by the polyclinics. Dr. Chris Opoku-Fofie, head of Safe Motherhood Program at the Family Health Division of the GHS, said all health facilities under the GHS run scans for free.
Within the service facilities, we have the health insurance tariffs that have been established, so all such ones are classified and are billed accordingly. Because we have what we call the bundle service, so where the facility doesn't have an ultrasound, they usually have some arrangement, partnership agreement with private facilities within their catchment area. So they refer the ultrasound scans to them, they do the ultrasound, and they are billed accordingly. So their health insurance numbers are documented, and after that they present the claims to the National Health Insurance Authority and they are paid. It's not supposed to be cash and carry. It's part of the service.
However, this investigation established a contrary fact. Many pregnant women were unaware of their entitlement under the FMHC policy. It also found that even when pregnant women who were aware of their entitlement put it to health workers and demand same, they denied it flatly that antenatal services are free. At the 37 Military Hospital, pregnant women are denied their benefit of free scan. A scan cost 100 Ghana cedis at this facility.
This. I didn't know which came of this. Yeah.
Pregnancy.
It's everything is. But this place we book.
You have to
come and do it today.
They'll give you appointment.
Oh, okay.
Yes.
It's 100 cedis.
Yes.
Wow. Would the health insurance cover the scan
Apart
for me?
Premium, do you have private premium?
No. I use the national health insurance.
No, then you pay. Well, not insurance, you pay. Apart from private insurance you won't pay.
Okay.
It was discovered that the list of laboratory tests given to pregnant women cost 250 Ghana cedis at the 37 Military Hospital. Other tests like full blood count cost 35 cedis.
Actually, now they 185 Ghana cedis. 185 cedis.
But health insurance, oh.
I'm not the best.
Hey, Ntanga, everything.
Keeping some for 185. Why specialized test to tell me if it's an abandoned.
Corruption Watch contacted the 37 Military Hospital for comments, but as at the time of filing this report, they had not granted an interview 6 weeks after submitting a request. Pregnant women who develop complications during the course of pregnancy at the 37 Military Hospital are made to pay for every drug, lab test, and scans on a cash and carry basis. What is more, if the pregnant women are detained for further medical observation, they are charged 60 Ghana cedis as admission fee for each day spent under medical observation. Despite having paid for every service already, during discharge, the bill is above 1,000 Ghana cedis and can increase depending on the number of days spent on admission. The delivery day is the most anxious in the 9-month journey of a pregnant woman. Not every pregnant woman that enters the delivery room is lucky to make it alive. Not every baby makes it out alive, and not every baby who is born safely survives the first few days. Hence, the moment labor starts, it is all prayer for families for the safety of mother and child. This stage is, however, a bumper revenue collection day for health facilities as they issue killer bills with no empathy. Partners, or sometimes friends and family, are traumatized with the guilt of failing to make timely payments for drugs and tests. Women who are not able to pay their bills are detained until the amount is raised by their family or a philanthropist. Delivery at the 37 Military Hospital makes no room for the poor. The maternity unit of this hospital is run like a private health facility with comparatively very high charges. Every single medication, materials or service needed for delivery is purchased by patients and their families on a cash and carry basis. It was also found that despite having a pharmacy inside the maternity unit where medicine could be dispensed when needed, pregnant women are asked to buy medical supplies even when its need is not yet required, sometimes leading to some women returning home with unused medical supplies like infusion when they are discharged from the hospital. Despite being made to buy everything and pay for every service in a cash and carry manner, the medical bill issued to patients during discharge is very high, with the lowest being above 1,000 Ghana cedis. Although the FMHC policy requires hospitals to submit all bills as claims to the NHIS without billing the patient any amount directly, 37 military hospitals does the contrary. They bill pregnant women for even admission and consultation at the maternity unit. Meanwhile, poor people referred to this hospital visit the facility hoping to depend on their FMHC entitlements. According to the FMHC policy, NHIS covers the bill 100%, hence does not cover part for pregnant women to pay for the other half. However, 37 military hospital practices the contrary. The bill they issue claims NHIS only covers a portion and the patient pays the rest. 37 military hospital issues bills ranging from 800 Ghana cedis to 1,000 Ghana cedis for women who have spontaneous vaginal delivery. This amount goes higher depending on the number of days the patient spends on admission, as 60 Ghana cedis is added automatically each day as admission fee. Out of this amount, the hospital's bill states that NHIS covers 159 Ghana cedis 70 pesos and the patient pays the rest. NHIS described this as unlawful.
Spontaneous vaginal delivery, where the woman delivers on her own, naturally, it is covered. Fully covered. When the woman is assisted to deliver, that is either cesarean section or vacuum extraction, that one too is covered.
37 military hospital charges between 2,000 Ghana cedis and 5,000 Ghana cedis for cesarean section. The longer you stay under medical observation, the higher the bill. According to information on the bill issued at the hospital, NHIS covers only 543 Ghana cedis 20 pesos of the total bill. The periodic postnatal care, commonly referred to as weighing, is relatively completely free at the 37 military hospital. However, neonatal intensive care unit NICU service is not free. At the 37 military hospital, newborns are charged a daily admission fee of 50 Ghana cedis. The number of days spent in the NICU determines the magnitude of the bill given to parents. At the 37 military hospital, babies who spend up to 3 days in the NICU are billed 1,064 Ghana cedis 17 pesos. According to the information on the bill of the hospital, NHIS covers 565 Ghana cedis 74 pesos of the total cost, while the family pays the rest. This amount has an automatic 50 Ghana cedis increment for each additional day spent at the NICU.
We have tariffs that covers babies that are sick. So that one too, when a baby is admitted at NICU, we have tariff for it. It is covered and they shouldn't be allowed to pay. When a baby is admitted, the baby or the mother shouldn't be allowed to pay because that one too is covered. When a baby is admitted at NICU, it is covered under the benefit package. Completely.
And the medication?
The medication is covered. The medication is covered.
We continue this investigation at the Mamprobi Hospital. This was the only hospital amongst those we investigated that required pregnant women to spend up to 96 Ghana cedis even before being accepted to register for antenatal service. As part of the registration expenses, nurses at the Mamprobi Hospital were also found directing pregnant women on their first visit to their welfare shop to purchase a mandatory package. This mandatory package contained some items needed only on the delivery day, but pregnant women were made to buy them at 26 Ghana cedis even before being registered and given their maternal health record book to begin antenatal. This package is given to the welfare shop by the nurses to be sold to pregnant women.
What happened? I just say.
I see list. List ni underpad.
List ni underpad. They didn't say anything. They just said we should come here. So at least say we deserve to know exactly what we are coming to
tell
pay for.
you everything that they are supposed to buy because me they're selling. They bring the things for me to sell. What you are saying. So they should explain to them. Say, oh, who better? Say.
Dr. Charlotte Cato, specialist in charge of Mamprobi Hospital, denied that the facility makes any demand before allowing pregnant women to access antenatal care. However, Corruption Watch's investigation found this claim by Dr. Cato to be false.
So if you don't have the insurance and you go and do the insurance, yes. But once pregnancy is confirmed, you start your.
So the pregnant woman is not required to have any there's no list of items to apply before you be able to start antenatal.
The Mamprobi Hospital officially charges pregnant women 35 Ghana cedis for a scan. This payment is made as many times as a scan is required. One other financially draining unique policy of the facility was that scans done in facilities outside the Mamprobi Hospital were not accepted by the health workers. Pregnant women who run scans before visiting the facility to avoid the queue are made to pay for a new scan, even if the first scan done outside was done the same day.
I don't think we have any problem with scan, no. We don't have a problem.
Despite establishing that Mamprobi Hospital charges NHIS holders 35 Ghana cedis for scan, Dr. Charlotte Cato denied the charges. According to her, the facility only charged pregnant women who do not have NHIS cover 30 Ghana cedis, but it is at no cost for NHIS subscribers.
So antenatal care, which is consultation, is free. Then drugs completely free. Scan is free. Lab free. And delivery is free.
Yes.
They are all free.
And the NHIS. Once you have NHIS, yes.
At the Mamprobi Hospital, pregnant women are denied access to free laboratory tests as well. The first group tests are divided into two. First half cost each pregnant woman 30 Ghana cedis. The other half of the test cost 20 Ghana cedis for NHIS holders. Meanwhile, all these tests are covered under the FMHC policy.
Insurance guy no almost and they don't cover na they don't cover.
Yeah, we insurance cover
30. Two different types.
We a scan, we a lab, 30.
I pay for the 30 cedis. Okay. And the first scan
na scan from Bele we scan. Now I put scan. Now I put scan.
But you time health insurance cover.
Health insurance cover. So health insurance. The only about pricing the low. It's only about pricing 20 cedis.
Then
so we have insurance on about 20 cedis.
20 cedis.
Not about my health cedis.
100. Wow. Oh, okay, so with the health insurance, no 20. Okay, I'll show you. That's.
According to the head of the hospital, Dr. Charlotte Cato, these tests are covered by NHIS in her facility, so pregnant women enjoy them for free. But Corruption Watch independent investigation established that the hospital charges for these tests. At this facility, antenatal drugs are free. The drugs are actually already packaged with a stationed staff right at the antenatal unit dispersing them. Vitamin C was, however, paid for. We end this investigation at the Mamobi General Hospital. Pregnant women were charged 10 Ghana cedis at the consultation room on a first visit. This, the nurses claimed, covers service delivery and some medical supplies.
Oh, okay.
At this facility, pregnant women were officially charged 40 Ghana cedis for a scan. This amount is paid as many times as a scan is required.
Where your labs? Where your lab? Where your scan? Okay, but your scan is 40 cedis.
Edem Dachomo, Principal Nursing Officer at the Mamobi General Hospital, who refused to grant a video or audio interview, said scans were not part of the FMHC entitlement in their hospital. Mrs. Vivian Adokobia, Deputy Chief Executive Operations at NHIA, said NHIA pays for scans through the claims.
In the operation manual, it states that when you go for ultrasound scan, 2 is covered. You understand? 2 is covered. During the first trimester, you can go for scan. During the last trimester, you can go for scan. But in between, if there's any indication, that one too is covered.
Okay, so if it's medically requested.
If it is medically requested, it is covered.
Dr. Chris Fofie said that facilities are operating according to the rules governing the FMHC policy by offering pregnant women a completely free laboratory service.
Blood group.
Yes.
Is it also covered?
Yes, all that is covered by health insurance, yes. GCSPD.
Oh, okay.
Hepatitis B. Yes, it's all covered.
However, this investigation established that laboratory tests are not free for pregnant women in any of the facilities investigated. At the Mamobi General Hospital, the first main laboratory test costs 50 Ghana cedis. Other tests done in the course of the pregnancy were equally not free. During another test at this hospital, the laboratory technician took the request form, samples for the test, charged 35 Ghana cedis, and received payments directly from the pregnant woman inside the lab without issuing a receipt.
35. I don't have change.
Wait for the results, okay?
Edem Dachomo, the Principal Nursing Officer on behalf of the facility, said the amount paid by NHIS as antenatal cover per visit is not enough to cover laboratory tests, although their supervising institution, GHS, supports NHIA's insistence that the service is free. She, however, said the hospital does not permit the collection of direct payments by staff for any service delivered apart from the bank. Hence, any staff caught doing that will be taken through disciplinary process for punitive action to be applied. At this hospital, the drugs that are available are paid for, and pregnant women are referred to buy the rest from private pharmacies on the grounds of unavailability.
You see, you have 15 cities.
Not 15 cities. Yeah, national health forms.
I know.
Drugs, scans, and lab tests during delivery, including blood, is paid for on a cash and carry basis.
First, I know, but they can be 50 cities. Which year have I had?
I thought Okra health insurance.
They wouldn't then cover.
Also part of the charges for delivery by CS were ward fee, CS procedure, suture, discharge among others, costing 1,200 Ghana cedis as official charges of the hospital, aside extra costs incurred from drugs and tests requested by the hospital, which are run in private facilities outside the hospital. NHIS described this as unlawful and unfair as well.
When something happens or you need to maybe augment the labor, put in infusion for one way or the other is an intervention. So if you want to set up a line, it is covered. It is in there. We pay for infusion during delivery. Everything is covered. Everything. As I indicated, apart from the exclusion list, every condition, if you look at, if you have listened to most of our presentations, 95% of the disease burden in the country is covered. So apart from those that are listed here as exclusion list, all conditions are covered. So there shouldn't be any reason why a pregnant woman should be allowed to pay. It is not right. It is not right. Wow. It is not right. It is not right. It is not right. All the medicines that are given during delivery, after delivery, and even postnatal, suppository is covered. Paracetamol suppository, diclofenac suppository, they are all covered under the benefit package.
Mamobi General Hospital offers NICU services to newborns. Although this service is supposed to be free, the service is not enjoyed for free. At the Mamobi General Hospital, NHIS covered pregnant women are required to make payment of 200 Ghana cedis or more as NICU deposit. Aside this, drugs, lab tests and RBS tests are all run on a cash and carry basis. NICU expenses alone can cost the parent over 500 Ghana cedis at the Mamobi General Hospital. Mrs. Vivian Adokobia said facility heads claiming ignorance about the benefit are not being sincere.
You see, when we are revising or reviewing the medicines list, we have the stakeholders there. So we just project what is we project the medicines list. Then everybody, all those who are invited to the room, they will make input. No, this one is far lower, this one is higher, this one is. So I mean, we dialogue with them. So we have their input before the medicines list come out. So that is how it is done. We have never single-handedly come out with prices or what we can pay or what we cannot pay. We have never done that.
Pregnant women are expected to budget up to 500 Ghana cedis for antenatal expenses in normal pregnancy and about 2,000 Ghana cedis or more for antenatal expenses during pregnancy complications. Mrs. Vivian Adokobia described these as barriers that prevent the poor from accessing antenatal care, defeating the purpose for which the policy was introduced.
It is supposed to, take out the financial stress or financial burden on the Ghanaian women. It is also supposed to encourage people to attend facilities so we can reduce maternal mortality in the country.
According to Mrs. Adokobia, all laboratory tests required in the course of pregnancy are all fully covered by NHIS. Hence, pregnant women should not pay any amount of money for that service.
Every single lab test required from the CHIPS compound through to primary care, through to primary hospitals, through to secondary hospital, to even tertiary hospital, it is covered. We have the benefit package for diagnostic services, and they are all indicated with how much each of these diagnostic investigation costs stated. So the pregnant women are not supposed to pay anything. If you look at the law, we have exclusion list. So apart from those that are stated as part of the exclusion list, everything is covered.
SDG Goal 3.1 targets the reduction of the global maternal mortality ratio to less than 70 per 100,000 live births by 2030. It further aims to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortalities to at least as low as 25 per 1,000 live births. According to the 2019 UN Interagency Group for Child Mortality Estimation, the infant mortality rate of Ghana is 34 deaths per 1,000 live births, and Ghana's maternal mortality rate is currently 308 per 100,000 live births, according to GHS. Although the infant and maternal mortality rate has been declining since the introduction of the free maternal healthcare policy, the margin of decline hasn't been different from the margin of decline in the years before the introduction of the policy. For Ghana to meet the SDG Goal 3 target, the policy formulators, as well as those at the point of service delivery, must ensure that the free maternal healthcare policy is made to work fully to remove barriers and expand access to maternal healthcare. Francisca Angel's report. Watch out for part 2 in our next edition for more shocking expose in other hospitals.